Sure. I feel like it's been forever since I have presented here, but hi everyone. I'm Amanda Newhouse. I'm clinical social work faculty at WVU Medicine in the Department of Behavioral Medicine. Um, I specialize in infant mental health. And so, one of the pieces that we do in infant mental health is we really focus on reflective practice, a lot of self-care and reflective practice, and really what we're experiencing in those moments. Um, so this is a big piece and a big topic that always comes up for me. I'm not going to lie, I need the reminders all the time about self-care. So when we think about self-care automatically and understanding the cost of caring for others, right? So when we think about what the cost is of caring for others, sometimes like just think about that for a moment for yourself and what comes up. Like for me, I just think of exhaustion, right? Like the word exhaustion comes into my head and pops into my head. And many of the times, there's a lot of different words that we use. People talk about feeling burnt out or compassion fatigue or secondary traumatic stress and vicarious trauma. Um, for everyone, right? And so we have a variety of individuals here that work with patients on different realms. And so whether you're working in the hospital directly with medical trauma or mental health trauma, outpatient in the home, you're going to face many different levels of secondary traumatic stress, right? Because we're hearing these stories. We're interacting with individuals who have come across trauma. Sometimes in the hospital, you're seeing medical trauma firsthand. Um, and so it's a lot of different layers that we're dealing with, we're hearing. In infant mental health, one of the symptoms of PTSD for kids 5 and under is just hearing the stories because parents will repeat the stories over and over again. Um, and so they almost, because they can't cognitively differentiate, they adopt that story, right? So they can't determine whether it's their story or not sometimes. And so a lot of the times, they feel those same responses. Now, as adults, we can differentiate that, but sometimes we still feel those same responses. And so, one thing that has been super helpful for me, um, in coming across and managing this because it comes up over and over again throughout our careers. And so one of the things that have been super helpful for me, and I'm going to admit, like a lot of this PowerPoint is not my own. It comes from Jenna Mosley Loans, and she's graciously donated some of it to me. But she does an amazing job of this, and she's actually developed a burnout protocol for our department for our therapeutic staff, and it's really helpful. But if you think about it, it comes up over and over again. And even though we use many different words, it's really good to determine the difference between them. And so we're going to explore a little bit about that and some vulnerabilities and what we can do about that. And so we'll start with compassion fatigue. And so if you look at compassion fatigue, that's that whole compassion stress and all of that exhaustion physically, emotionally. It impacts the way you think, the way you feel, how you're interacting at work. An interesting piece on compassion fatigue that I found through the research was that it impacts your spiritual growth and development. So for those of you who are growing spiritually, a lot of the times when you're feeling compassion fatigue, you'll create a distance between you and that spiritual growth, and that can be kind of one of your red flags that like something might be going on, right? Because a lot of individuals, what the research has supported, that a lot of individuals look to their spirituality to help prevent that compassion fatigue. So, more of a preventative method. And so, when you start to separate from it, you can maybe see some of that compassion fatigue kind of jumping up there. I thought that was super interesting. I wanted to share that. Um, but compassion fatigue, like I said, it's that complete emotional distress, that exhaustion, physically, emotionally, cognitively. Sometimes when you're not able to really even think straight. Um, and so it really has almost some fatigue symptoms close to PTSD. And so while we're trying to understand those differences, one of the ones that really imitates PTSD is that secondary traumatic stress. And so, secondary traumatic stress, a lot of the times, can exhibit very similar symptomology. So, that depression, insomnia, obsessive thinking about the trauma. And so, constantly thinking about the trauma that was shared or the details that were shared. Some of the pictures we create in our mind when somebody is telling us a story, right? An increased hypervigilance around a certain topic that we might learn about. And so some of that increased trauma. Now, the difference with secondary traumatic stress and the vicarious trauma is if secondary traumatic stresses is left untouched, if we're not kind of caring for that, taking care of ourselves, and integrating some of those resiliency skills, then a lot of the times it can become some vicarious trauma. And vicarious trauma shifts the way we look at the world, right? So then we start to adopt some of those cognitions about or beliefs about some of that stress. So this is maybe where, if you're constantly exposed, I knew a colleague that worked in the emergency department and constantly exposed to like motorcycle accidents. So her belief then was like motorcycles are awful, right? Like motorcycles are just bad. But that's being exposed to that stress, right? So now this has completely changed her view. Um, so yeah. Um, And then when we think about that, when we think about the way that we look at the world, and if that does shift for us, it shifts a lot of major pieces. So it can shift like our safety, how we trust other individuals, the power people have to do that, our own self-esteem, how we deal with things, how we interact with colleagues, coworkers, family members, intimate partners, right? And so things can start to look very different to us. And so we want to make sure that we're coming in and we're handling that, we're taking care of that. Burnout. So when we think about burnout, everybody always goes to burnout, right? I used to be one that always said I was burnout too. Like I think I still catch myself all the time and I'm not really burnout. It's more compassion fatigue, but I always say burnout. But understanding the difference has really helped me prepare and manage myself a little bit better. And so burnout is that feeling of exhaustion, right? Just completely depleted, like you're just done, like ready to give up. But it's also some of that job satisfaction. So, not feeling like you're really good at your job, not feeling motivated or wanting to work towards any of your goals at work, really just feeling powerless at work. And so, we see that a lot more with burnout. And burnout, a lot of the times people are like, well, stress causes burnout. Stress doesn't cause burnout by itself, but stress and the feeling of inadequacy can cause burnout. And so that's where we can overcome that a little bit. Sometimes some of our situations we can't change, we can't control some pieces. So we will be stressed by it, but we want to overcome some of those feelings of inadequacy. And that's really important to overcome. I think back, like, I think it was 2020 or maybe 2021. We had a provider satisfaction survey go out, and a lot of our providers in our department talked about their satisfaction at work. And one of the highest satisfaction points of why people continue to remain employed in our department was because of their colleagues and coworkers, really promoting them, supporting them, giving them kind of the accolades that they need, right? If you think about that, that helps you feel adequate as an individual, like you're doing what you need to do. And so it reduces that feeling of inadequacy and actually can help mitigate that feeling of burnout. And so that feeling of adequacy is really important. So having that support come in along with that stress really can overcome burnout. So we want to make sure that we're balancing that out. It's really, really important. But there are definitely some vulnerability factors. So if we think about what makes us vulnerable for feeling any of these, There are some high pieces, right? So how do you show up to any type of situation or dysfunction, right? Are you really super empathetic? Do you wear your heart on your sleeve? Do you go into a situation to where you become just as emotional as that other individual or take on those emotions, right? And so are you super empathetic? Um, and that's okay if you are, right? But being aware of that because that leaves you a little more vulnerable. So what you can do in the other end is create healthy boundaries. And so some preventative motions is to create healthy boundaries for yourself. Identify that and then create those healthy boundaries. A lot of the times people will say, "I'm sorry, I'm so emotional." Like I'm an emotional person. Well, you're an emotional person. Don't be sorry about that, right? Like, but we have to understand when we go into some of these situations that that can drain us a little bit more than other individuals. And so creating some of those healthy boundaries for yourself and exploring what that looks like is really important. Another piece of vulnerability is your own personal trauma. So having your own personal trauma, or it doesn't even have to be similar issues to what you're listening to or what you're dealing with, right? Naturally, those can be automatic triggers, but sometimes our own trauma can surface and float up in weird ways. And so you want to be aware of that. Sometimes just triggering that emotion or that similar emotion or hearing how that emotion is being dealt with can trigger some of that trauma for yourself. And so you want to be aware of that. Dosage. So, not really dosage, but your caseload, right? Your caseload, who you're interacting with. Sometimes we have absolutely no control over this, and sometimes we do. You know, if you're working in a hospital, you have no control of the flow of patients that are coming in. If you're working in outpatient, sometimes you have no control of the patients that are filling your schedule, right? If you're working in homes, sometimes you have no control. If you're working in crisis, you have no control of those crises. But paying attention to your caseload and what's coming up and trying your hardest or what you can do to kind of manage some of that. I try my hardest, not always capable of doing this, but I try my hardest not to make my extreme trauma patients all on the same day. That is an exhausting day for me. And so I try not to schedule them all on the same day. Sometimes I have absolutely no control over that, and it happens. But one of the things that I have come to do that has been super helpful for me is on Fridays, I review my schedule for the next week. So then I can determine for myself what my weekend is going to look like if I can. If it's not already booked, then I can figure out what I can do for that. If I can pick like some things up, or if I just need a relaxing, reviving weekend because it's going to be a tough week, right? And so, um, I do that for myself, and that has reduced my, that has reduced my quality of life in that secondary traumatic stress area. So I've been able to manage that a lot more. Emotional versus problem solving coping strategies. So do you emotionally respond or do you go to problem solving? Now, here's the reality. This might be a vulnerability factor, but again, this is something that you can't always control. So sometimes you do have an emotional response, and sometimes we go to problem solving. It can be super helpful to go to problem solving, but sometimes our patients and families aren't ready to go to problem solving, so we have to stay in that emotional piece. Just being aware of how that impacts us, right, and not pushing forward can be helpful. For me, I still move to problem solving in my head, even if they're not ready to. That way, my emotions are moving forward. And so even if theirs aren't quite ready, my emotions are moving forward. So this is what I've utilized. So this is the quality of life measure. This is the ProQual. And it is a self screener. And when this PowerPoint's sent out, you can go to the website and do the self screener. It has the rating scale right in there. It can tell you how to categorize it. So it's going to categorize it for you, whether you're experiencing more compassion, fatigue, secondary traumatic stress, or burnout, right? And this really, and it also gives you self-care tools that you can utilize depending on what you're experiencing, right? This is super beneficial. Again, it helps you identify what you're struggling with in each area. I have no shame in my game. I'm currently moderate in all three areas. So this has come at a perfect time, right? I'll be honest, sometimes when I see self-care pieces come up as educational pieces or some CEUs, sometimes I'll skip out on it because I'm like, I know how to do self-care, but we need these reminders. And I'll be honest, every time I go, I get a nice little tip that I can take away. So hopefully you all get a nice little tip that you can take away and utilize for self-care within here, even if it's just the measure, right? So utilizing that measure. So in a nutshell, what you want to do is you want to kind of, we went over each area and how to categorize it. And the reality is, if you don't, the longer you stay in burnout, the harder it is to come out of it. And so research has really supported that it's like the longer you're there, the harder it is for you to overcome that. And so when you're starting to feel burnout, you need to start taking strategies to overcome that. And it's really important to do that. Individually, you can do that, but also as an organization and starting to talk about some of that organizational change can be really important to have compassion, satisfaction. Super important, especially in the line of work that we do. So, looking at ways to incorporate protective measures even at work can be super helpful, even if it's just for yourself. But organizationally, there are some things that you can do. So relief, rest, and revive. Super important. So you come up with a baseline of where people really start. And it's an individualized and personalized plan, right? Where they start, what becomes too much for them, if there's a way to manage their caseload. Um, so I know that we've put this protocol since Jenna has developed it for our clinical therapists. We have put this protocol since I've been in leadership. We've put this protocol in place 3 times that I know of. And it's been super helpful, especially with newer staff, right? So younger and newer staff. We've utilized this with because clinically, as newer staff come on, they don't always know exactly what to do, where to go, and they're slammed with this huge caseload, right? And so, really, we individualize that. We reduce their caseload for a small time period, and we work with them on what their baseline is and how we can overcome like some of the difficulties they're having and self-care, right? Self-care is really important. Um, but also, I think making specific time for supervision and processing time, all organizations really should have that. You need that time to process. You need supervision. We have supervision not only for licensing, but we have group supervisions. I have 2 sets of group supervisions that I do. And a lot of the times I have one of our senior leaders run that group supervision so that I can also participate in it. For I am a reflective supervisor for the state of West Virginia. And so, in order to maintain that license, I have to receive so many hours of reflective supervision myself. That's very important to me because I need that. I need that time and space, right? You have to make that time and space for yourself, and exploring that and really talking about what was hard and what was good. And as leadership, starting to do that. So, if you are in leadership, starting to do that yourself. I know I am a super poor example of this, but one of the examples is that, if you're in leadership, being aware of responding to emails and phone calls after hours, like in the evenings or on weekends, because it leads people to think that they have to respond in that same way. I'm super bad at that because sometimes those are the times that I have to do that. But self-care is important. And when I need self-care and when I see some of this, I definitely scale back on some of that. And organizationally, if you can't move in that direction, taking some individual steps are super helpful. So making sure a lot of the research too. So I'm doing this. Well, I did this compassion fatigue workbook, and and I have it here because I was pulling from it. Um, so this is the compassion fatigue workbook that I was doing. It's by Francis Matthew. It's a French name, so it's spelled completely different. Um, but it is a really great workbook. It talks about the quality of life. It talks about a lot of what I put in here. I definitely pulled some pieces from this, but it really steps out ways to utilize self-care and to really develop a plan for yourself. Like it gives some great ways. But the eat, drink, move, and sleep, those are big pieces. Everybody always talks about that, but it really is a big piece. And like they have cool things in that workbook, like one that I did was like a 5 out of 30. It was like five fruits and vegetables a week for 30 days, right? Like so trying to do and I mean eating healthy is always super beneficial, but it's helpful for self-care too. And so that was, something it has cool things like that like just challenges that you can do for yourself that can lead to self-care. So making sure that what you're eating, drinking is important. I know if I don't get at least 8 hours of sleep, I am miserable the next day. So I know that I need 8 to 9 hours of sleep. Nothing impacts my sleep, and when it does, it's awful. Um, but knowing yourself, capturing your values and your beliefs, do it on a good day, right? A lot of people will start when they're feeling down and they're like, I need to do better for myself. Like, I had such a crappy day. Like, I'm going to start self-care. Like, but then you're thinking so negatively. So wait for the good day and do it on a good day. What was good about today? What made today good? How did I make today good? And keep doing those pieces, right? That made it good. Do therapy for yourself. I know as a social worker and counselors too, part of our schooling is having to do therapy at some point, right? Continue that. There's nothing wrong. I see my therapist, I mean, it depends, right? Variety of times. Right now it's every other month, but that's great. And that increases depending on what my needs are. And so that's really important too. Being mindful. So, intentionally paying attention to the opposite of your hard. What is your good? What are you good at? Um, what makes you good at that? Pay attention to that and build on those pieces. Transition rituals. We get away from this, but rituals are super important, especially transition rituals. Of course, anytime someone receives licensure or promotion or, you know, s- a publication, like you want to make sure that we're providing a ritual around that. Like this should be a celebration, but also other transitions, right? Out of hard times and hard places. So if somebody decides to say no to something, right? Celebrate it. If somebody's always saying yes and they're like, nope, I'm gonna set my limit there. Good for you. I think that's amazing that you're setting a limit for yourself, right? Celebrate that. That's important. Talk about it. Talk about the issue, debrief it, give yourself space for it. So I've had a couple individuals that struggle with taking it with them, right? And so it goes back to that emotional contagion. Like if you become very emotional and you obsess about it and you're in that secondary traumatic stress and you're obsessing over something and you're one that just takes it with you, process it, put it in a container and put it on the shelf for later. And so talking about that container method can be really helpful. Good, bad, and ugly, even some of the good stuff, right? Put it up there and put it away if you're obsessing on it. But finding a way to container it and put it away, put it up on that shelf for later. So then that way, it's easy for some people to say you need to just let that go. Some people can't let it go. So if you can't let it go, container it and shelf it for later. Um, Remember your wins. Sometimes we don't see big wins. We don't need to see big wins. It's the little wins we need to pay attention to. Little steps lead to big ones. And so pay attention to all of those little wins. Giving yourself grace is really important. So, that self-compassion, especially for new providers, right? Who are just learning, and older providers as you're learning new strategies, right? And so, giving yourself grace and remember to play. Always play. We'll talk about different kinds of play as adult. One of the things that I learned through this that I thought was super interesting. And I was like, oh my gosh, I slime people all the time. So when we say talk about it or debrief, make sure you're talking about it. Yeah, talk about it, debrief, but don't slime people, right? This is where you go to your colleague that you always go to, or your mentor or your supervisor, and you're like, bleh, and you just tell them everything, right? And so whether it's formal or informal, try to avoid sliming people. Be self-aware of what you're sharing. You definitely want to share, but if you need to dump, give them fair warning, right? So what I started doing is I'll text the person I go to and I'm like, "Hey, I need to dump, like completely just word vomit." And they're like, "Can't right now." This gives them the opportunity to tell me when they can, because then I'll say, "When can you?" And then they can tell me when they can be emotionally available for me, because I'm not taking all of their space and I'm not sliming them then, right? They're giving me that time and space to do that. And I'm giving them fair warning, like, I am dumping on you this time. Like, this is a full dump, not a discussion, not a consultation. This is just a dump. Um, Limit what you're disclosing, right? We don't have to disclose everything for them to get the picture. You know, if you're dealing with a sexual assault, you can say a sexual assault. You don't have to give illicit details, even though they were given to you, back to that person for them to understand. And so this way you're not sliming them. You're still limiting what you're disclosing. So it doesn't become as heavy for them. And so I loved this when I heard this, because I was like, I need those visuals, right? And I'm like, yeah, I'm totally gonna try not to slime people anymore. Like, I don't want anybody to walk around in that goo. Um, but you still have to talk about it in debrief too. And so having those opportunities to do that. And playing is super important. So play is the way that kids learn, right? So working with kids, naturally play is fun for me. But play is the way that kids learn everything. Play is also the way that adults learn as they process too. So a lot of physical play can be some of that midline crossing, so that right and left side of the brain. So while you're doing some of this play, you're also releasing some of that secondary traumatic stress that you may have endured. But also, there's a lot of different ways to play. And so, whatever is comfortable to you. I will say the storytelling has been amazing. So, I started storytelling, like just writing them, and it's amazing, like what goes through your head when you should try this. So it's come up for me in the past 2 years how amazing storytelling can be. For those of you who work with kids, you know that storytelling can be used in a lot of different strategies when processing trauma. Trauma informed care definitely utilizes storytelling. um, uh, Trauma focused CBT utilizes storyboarding, right? And so there's a lot of different ways for storytelling, but I've been to two conferences over the past year where storytelling was, there was a keynote speaker who was a professional storyteller. And I'm thinking, all right, like what is this going to do? But let me tell you, when she reads a story and you create these vivid like images in your head and like start it becomes your story. And she talks about how that links us to kind of processing through things in our own brains. And like she had a lot of neuroscience behind it. And I was like, this is fabulous. So it's really exciting. You guys should look into storytelling. That's my new thing. Um, don't get stuck in a toxic rut, right? This is super easy to happen. It happens all the time. But sometimes we have to take initiative. And so, tame that negative colleague, right? Tame that toxic person that just continues. If you're sitting in a meeting for the past 3 months and you've addressed the same thing, right? That's kind of a negative rut. You got to move forward from that. And sometimes, sometimes professionally, it's one of our jobs to bring to attention to everybody, right? Like, what are we doing? How can we move forward? And so trying to get out of that negative rut because it can impact everybody. Explore your agency mission and how it aligns with your mission, right? I hate to tell you all this, but you're not going to really change your agency mission. You might be able to help it kind of fit yours a little bit, but you're not going to change it. And so if they don't align at all, you might be in the wrong area. And so I know that's really hard for some people to look at, but I think it's really important because then you're fighting this battle that you're never going to be able to win. And so that goes to that last part of identifying what you can and can't control, right? There are just some things we cannot control. There are definitely things that a lot of different organizations and agencies are willing to work with you and help you and support you and help meet your needs so that you stay. But you're not going to change a whole mission. And so if it's not aligning, then maybe you look for something that does align for you. Um, you'll get more compassion satisfaction there. Explore how you can change your work and improve your work and the environment that you work in. So what are you doing, right? Are you the toxic colleague that's keeping everyone in a rut, right? Are you focusing on some of that negativity? I've been that toxic person before. I've had to explore these areas and handle my own burnout, right? So that it wasn't impacting others. And so this is very easy to fall into. So really exploring what you can change for yourself. I am not, I think I've shared here before, but I am not like a big mindfulness person, as in like stopping and taking deep breaths and grounding myself. I'm not really great at that. But I have been using the 1 minute mindfulness in breathing, right? Like just 1 minute in my workday. And sometimes it literally is only 1 minute, but sometimes I take several 1 minute ones. But sometimes it literally is only 1 minute. And let me tell you, it helps me reset significantly. So I know that that helps me improve my workday and my work environment. The same thing with, I think of that inadequacy. So one of the things that I also do is, and especially since COVID, I tend to sit in my office and not go anywhere because everything's either on the screen or I have people, right? So I take a sticky note and I'll put it around my monitor, and I'll try to move that sticky note all the way around my monitor and go out to say hi to somebody or something positive to somebody. So it forces me to make an effort to do that, because if not, I'll totally hibernate in my office. So I really try to do that. But that helps improve my workday, and hopefully somebody else's at some point. But think about what helps improve your workday. So take the steps today, take stock, do your quality of life measure, see where you're at, see where you're struggling, see maybe you're not, maybe you got complete compassion satisfaction. But work to enhance some of that self-care preventatively so that you don't end up in those places, or start to become more aware of it and incorporate them a lot sooner, right? Develop some of those resiliency skills, and make that commitment to change. So you have to commit to it and follow through with it. But you're worth it. You're super worth it. And so do that for yourself. Um, I love this. I really believe that the one reason most people come into my office is to sit with someone to just regulate their nervous system. I think of this and I think of that sliming, right? Like I think of how many times I went and dumped on people. And now I think about how many times I just go and sit in somebody's office and they're like, "Do you need something?" I'm like, "No." And then when I read this, I'm like, I just needed to like regulate. Like I just needed to be with another human, especially when I am online a lot. Like I just needed to kind of regulate our nervous systems. And I thought of, so when WVU medicine first got therapy dogs, one of the homes of our therapy dogs was in our department, and and he was there all the time. And I remember his owner telling me, she said, it is amazing to watch like some of our providers and the residents just come in and cry with the dog. Just cry. Like nothing real, just needing to cry. And it's just that other person that you're regulating, right? And your nervous system is just kind of regulating with. And I think of some of that secondary traumatic stress that we're experiencing sometimes and how important that is. So that is my talk on self-care. And so hopefully you guys got a little smidget from it, or a big smidget from it, and it's going to motivate you to make some sort of self-care plan. Right now we just started thinking about our annual reviews as faculty. Can you believe that? Like for the summer. Um, Colleen's like, no. Yeah, it's almost that time to start thinking about that. But I always put in my annual reviews like something about like the self-care piece, right? And because it's important and I lose focus of it. I need pieces like this to bring me back. I lose focus all the time. So, yeah.